Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Kody Sexton. He's a graduate student. His Kevin MD article that he co-wrote is titled The Impact of Medical Traumatic Stress on Families. Kody, welcome to the show.
Thank you. Happy to be here.
So, just briefly share your story and journey to where you are today.
Mhm. I'm currently a PhD candidate at the University of Tennessee, Knoxville in the counseling psych program. I actually started off in higher education. So I worked for a bit as an academic and career advisor. And it was really through that experience that I got interested in mental health and how it intersects with academic and career planning. So that led me to seek out this PhD program. And I thought I was going to always stick working with college student populations, but ended up in a practicum placement where I really got some great experience working with younger kids and youth, and just found that I loved that setting. I loved that developmental age range, especially as it related to preventative care. So I got really interested in that, and that kind of led me into the field of pediatric care.
All right, wonderful. And we'll talk about your article in a little bit. One thing that you said kind of piqued my interest, that intersection between kind of academics in a higher education setting and behavioral health, stress. And we hear a lot about that in the news. So talk a little bit more about that intersection and what are you seeing?
Yeah. So especially when I was working as a career advisor, I worked mostly with STEM students, so college students pursuing technology pathways. And I realized really quickly on that it was pretty easy, relatively easy to talk with them about what classes they were going to take the following semester. But what would come up so often was just life stress,
Yeah.
right? Adjusting to college, symptoms that they had never experienced before that were really impacting their decision-making skills, their sense of belonging, some pretty significant mental health disruptions that would impact academic functioning. And really through that, I just realized it's one thing to help you plan out your schedule, but we really can't do that until we get you to a place where you are psychologically safe and you are well resourced with mental health care.
So I think I just dropped off my daughter. She's going to be a freshman undergraduate student. So for those other undergraduate students who may be listening to you and maybe undergoing some of the symptoms that you described, what kind of advice do you have for them?
Yeah, great question. I would say first, you're not alone. And I know that's almost cheesy to say. They might hear that often, but as someone on the other side of it, working professionally, there are so many students who don't expect to have mental health concerns or maybe hadn't prior that get to college and suddenly there's a lot more to deal with. And it's perfectly normal. It makes a lot of sense that those things can come up. And there's so many resources on campus. That's one of the wonderful things about the collegiate setting is that there are trained professionals who are there for you and are happy to provide services to get you to where you want to be.
All right. Now let's move on to your Kevin MD article that you co-wrote. It's titled The Impact of Medical Traumatic Stress on Families. And this article starts off with a quick anecdote. Why don't you share that anecdote with my listening audience and then talk more about how this article came together?
Mhm. Yeah. So we wanted to start off with an anecdote, really just to sort of bring home exactly what this might look like in practice in terms of medical traumatic stress on families. I work in East Tennessee, and so I work primarily with rural populations. And I think sometimes when we talk about sort of intersecting identities or social identities, rurality and geographic location can sometimes get forgotten or maybe a bit hidden. And so with the anecdote, we wanted to highlight the experience of a father who was low income from a rural background who, had to travel a far distance to get to the hospital setting where he recalls the experience of his newborn being intubated. And I think that is a really practical case example there. Definitely something that in different ways I've seen play out in my own clinical training.
All right. So how does that lead into some of the points that you want to discuss today?
Mhm. Yeah. So the big takeaway really of the article is that medical traumatic stress is not something that just can impact pediatric patients. It can absolutely impact those who are caregiving. So that can include parents, families, others in the caregiving system. And that, just like traumatic stress broadly, medical traumatic stress really intersects with people and their socio-political locations, their personal identities, their geographic context. All of those social locations really play a role in how traumatic stress shows up. And really, because of that, as providers, we have to think about how can we intervene accordingly to address all those factors.
So we always hear from the caregiver standpoint. I've interviewed several caregivers, is that often their own care comes last after the person or people that they're taking care of.
Mhm. Yeah. It seems like that's such a area for growth for us as providers, right? Is to really prioritize the caregiver mental health side, knowing that it has such a direct impact on pediatric care.
So assuming that caregiver stress, medical traumatic stress, isn't addressed, what are some of the repercussions that you've seen from this being untreated?
Mhm. Yeah. Yeah. I would say one is like something like disengagement, right? We might easily read a family as being disengaged from the treatment process. And that could be because, unbeknownst to us as providers, they're really dealing with their own mental health concerns. They're dealing with the medical traumatic stress reactions that they had after watching their child undergo a procedure. So I think just in our framing of how we imagine or conceptualize the patients and families that we work with, that can really get in the way. We can view them as disengaged, non adherent, some of those kinds of factors.
And what kind of interventions are available for these situations?
Yeah, so there are some programs across hospitals and healthcare systems that treat caregiver mental health directly in the pediatric setting. I think perhaps more commonly, at least for the time being, the field tends to address caregiver mental health, maybe in a small way, provide some initial resources, but tends to sort of refer out. So I think where the field is going, and what I think would be really helpful ultimately, is having specialized services within that pediatric setting where caregivers can get the assistance that they need and deserve. But the actual interventions look really similar to what we might think of for other presenting concerns. So addressing anxiety, addressing depression, addressing traumatic stress.
Any tips that you could share with clinicians if they're seeing a family, if they're seeing caregivers, anything that they should be on the lookout for to perhaps suspect caregiver stress and perhaps intervene?
Yeah, I would say one thing to look out for could be almost the sense of overcompensation, right? So if we might see a parent or caregiver who is like, oh, yeah, this all makes sense. I got it all figured out. Everything's good to go, right? In some cases, that might be a great strength and that might be something that the caregiver really experiences. But in other cases, that might be a sign that they are struggling and they're just so used to being put in this position of being the caregiver and holding all the knowledge and understanding all the medical information that it's hard for them to say, you know what, I actually am really confused. I really am overwhelmed about how to engage in this aftercare plan. So, really, just slowing that process down, getting curious about the caregiver's experience, and just checking in with them. And I think a small way a clinician can do that is even just by naming, we may not have asked you enough in our visit today, but let's just slow down. Is this all making sense to you? What else can I clarify today? Can be a way to sort of break the pattern.
Now let's talk about what caregivers themselves could do because as we talked about, often they're just overwhelmed with so much information and there's so many things that they have to do to provide those caregiving services to their loved ones. They may not even be able to recognize the stress that they themselves are undergoing. So what kind of tips do you have for caregivers to not only recognize this, but if they do recognize this, take those next steps?
Mhm. Yeah, I would say it can be helpful to, as much as one is comfortable, like talk with others about it. I think the experience would quickly be that there are other caregivers, there are other people out there, families out there who've gone through similar experiences and can share some tips or even just normalize. Like, yeah, when my child was hospitalized or when my child received this diagnosis, here's what I was going through. Here's how I decided to manage that. So I think definitely reaching out. I do think there are some really useful like caregiver voices out there, caregiver organizations where there are free trainings, there are free opportunities to talk and get to know and build some community with other caregivers of kids with chronic illness.
One intervention that you mentioned was acceptance and commitment therapy. What exactly is that?
Yeah, so acceptance and commitment therapy is an approach, behavioral by nature, but it really focuses on building some tolerance for tough emotions and tough thoughts with the recognition that we can't get rid of those things, right? That struggle is an inherent part of life, that difficulty and difficult emotions or thinking patterns will come up in our lifetime. And if we can build some reasonable or creative acceptance of those things, then we don't have to spend so much time and energy sort of fighting them. So, fighting not to have the symptoms, fighting not to have those thoughts. It's a really effective therapy, not only for caregivers, but more broadly for children and adults.
So, can you give an example, anecdote, or a story of how acceptance and commitment therapy would look like in a real life setting?
Yeah, yeah. So, one of the big practices in acceptance and commitment therapy is mindfulness. So, one metaphor that we use often, especially in my work with kids, is like imagining our thoughts like they are people or other kids on a bus. And we're sitting in the house watching that bus filled with all of our thoughts or filled with all those people just driving right by us. Right. So instead of trying to say, oh gosh, this thought that I keep having, it really bothers me. I wish I could just get rid of it. We kind of embody that mindfulness skill to say, I can't get rid of it, but I can create some distance between me and that thought as if it is just driving past me in that school bus. And that's a way to, again, practice that acceptance piece.
We're talking to Kody Sexton. He's a graduate student. His Kevin Henry article that he co wrote is titled The Impact of Medical Traumatic Stress on Families. So, Kody, tell us the next steps and how we could better manage caregiver stress and what are some suggestions that clinicians and their offices can implement to address this.
Yeah. So in a recent article, it was identified that there are really kind of three main strategies for providing caregiver mental health services. The first is to take caregiver mental health and subsume it as part of the child's care. Another option, which right now seems perhaps to be the most common, is to refer the caregiver out to another provider or to another service outside of the pediatric setting. And the third option would be to treat that caregiver directly in the pediatric setting. So I think ultimately what I personally would like to see is moving a lot closer to that third option, where parents and caregivers of kids with chronic illness can, come in to receive treatment for their child and at the same time receive treatment for their own mental health concerns, especially medical traumatic stress. In terms of clinicians and what they can do about it, I really think screening is going to be something important for all providers, but screening parent mental health concerns, especially among those who have kids with chronic illness.
So, talking about that third option in terms of addressing that caregiver stress right in the pediatric office, what would that look like? Would you have behavioral health specialists embedded within the pediatric practice to address this?
Yeah, I think that would be a great start to have like a designated caregiver support team, right? So somewhere where maybe if the child is receiving help in the moment, that the members of the family, members of the caregiver system can also receive behavioral health support. I think it would be a wonderful thing if there were more support groups just for parents and caregivers, maybe that run during the day or even later in the day so that parents and caregivers can attend, so that they know that while they are there to focus on their child's care, the pediatric portion, that we as providers serving pediatric populations recognize that the best work that we can do is always going to foreground caregivers because their mental health, their experiences directly impacts child outcomes and their care. And so, if we can have those support groups, those specialized behavioral health services within the pediatric setting, it provides a bit more wraparound care for the families.
And tell us some of your take home messages that you want to leave with the Kevin MD audience.
I would say the first again is to just stay curious, to stay curious about what it is that parents and caregivers might be going through as they are receiving care for their child, and also to really be mindful about how medical traumatic stress is not a one size fits all, right? It can really intersect with the other identities, the other cultural backgrounds that parents and caregivers hold. And some of those factors can be like cultural strengths, some of those can be cultural barriers, but it's really important for us to be mindful of how medical traumatic stress directly intersects with things like race and racism, gender and genderism, and even geographic location.
Kody, thank you so much for sharing your perspective, time, and insight. Thanks again for coming on the show.
Thank you.